Hello, today our group is going to present on the topic Epigraph, which is a bioengineered skin substitute. So now let's talk about some introduction. Tissue engineering combines biology and engineering to replace damaged tissues. This is critical for chronic wounds like diabetic ulcers, which often fail to heal and lead to severe complications. Epigraph addresses this by providing a temporary scaffold, stimulating the body's natural regeneration, significantly improving outcomes compared to standard dressings.
Coming to Appligraph. Appligraph is a bioengineered living skin substitute that mimics human skin with two layers, an epidermal layer of keratinocytes and a dermal layer of fibroblasts in a collagen matrix. Unlike traditional dressings, it actively promotes healing by releasing growth factors and cytokines that stimulate tissue regeneration. It is mainly used for chronic wounds such as venous leg ulcers and diabetic foot ulcers, where natural healing is slow.
What is collagen scaffold? A tiny 3D support network. It's made of collagen. It's a biocompatible and biodegradable. It's where cells find a safe place to live and grow. It's similar to extracellular matrix. It's where fibroblasts and body's vessels grow, and it fasts the wound healing process. And in the image, we can see the top layer is epidermis, middle layer is dermis, bottom is the collagen scaffold, where the fibroblasts come and where the wound healing happens. Epilograph works as the mechanism of a temporary catalyst where it also secretes growth factors, and these secretions makes cellular activation and calms down inflammation, which leads to the matrix repair.
So now coming on to application, how can a Epigraph be applied on a foot skin graft? So firstly, preparation is done in which wound cleaning and debris event happens. Secondly, graft process happens where skin is harvested, placed on the wound and it secures the graft. Thirdly, healing support, which is dressing application and protection, as you can also see in the video which is shown on the right.
Let's look at its benefits. Chronic wounds often fail to heal due to poor blood supply and lack of growth signals. Appligraph helps by introducing living cells that release growth factors, which promote new blood vessel formation and tissue repair. It also acts as a protective layer over the wound, reducing exposure to bacteria and lowering the risk of infection and complications. Another key advantage is that Appligraph avoids the need for traditional skin grafting, so there is no second surgery or additional wound, making the treatment less painful and more comfortable. It is also FDA approved, meaning it has been clinically tested for safety and effectiveness and is widely trusted in medical practice.
Now, we look at some important limitations of Appligraph. First, it is relatively expensive, which restricts its use in low resource clinical settings. Second, its short shelf life creates logistical challenges. It also requires trained medical professionals for proper storage and application. Finally, Appligraph is mainly effective for chronic ulcers and is not suitable for deep, highly infected, or complex wounds.
Talking about future scope, Appligraph is already a major step forward in wound care, but its future potential is even more transformative. First, 3D bioprinting could enable fully customized skin graft tailored to a patient's exact needs. Second, integrating biosensors into these grafts can allow real-time monitoring of factors like infection, moisture, and healing progress, turning passive dressing into smart responsive systems. Third, gene-edited grafts offer the possibility of enhanced regeneration, where cells are engineered to accelerate healing. Together, these innovations signal a shift from static to dynamic, personalized healthcare.
And here are the references which we used for making our presentation. And also we have mentioned the references in the slides itself.